Welcome to Season 2 of Digging Deeper Ag Chats with Al, the podcast that brings you timely and practical stories straight from the paddock. From sowing to shearing, fire to flood, and everything in between. We're here when it matters most. Each episode taps into real experiences, expert voices, and grounded advice that helps you stay ahead on farm. I'm Alistair from the Gippsland Ag Group, a grassroots, farmer-led network in Gippsland, focusing on soil, grain and fodder, pasture and livestock. We're here to support producers in building resilient and profitable enterprises across our region. So let's dig in. All right, welcome back everyone to Dig In Deeper. We've got Chelsea, our once a month vet, come in for a discussion. We've got a few different little topics to talk about today, Chelsea, but how are you going?
Yeah, it's been good, Al. Back into calving season, so it's been keeping us a bit busy, but no, other than that, everything's ticking along well.
Yeah, now last we heard you said it was supposed to be a quieter month, but then it got busier. And then I learnt that your boss, Alison, actually took off overseas for like 4 weeks too.
Yeah. So I've been on sole charge for just over 4 weeks. So, yeah, that definitely doesn't make it easy. It's a bit of a challenge when she goes away. Mostly just answering the phone while you're doing jobs is probably the hardest part. So I remember one day I was doing lame cows, and I think in the time it took me to do 8 lame cows, the phone rang about 17 times or something. So
Yeah, right.
Sometimes that's the hardest bit. So yeah, I managed. So
But when do you get time off?
I was actually, Alison and I were having a chat about that last night, because she said you've got too much annual leave and you need to take some. So I think I might take a couple of weeks off once calving season settles down a little bit.
Yeah. When does that? Like late September?
Late September. So I might try and squeeze a week in between now and then. But yeah, the problem is though, like you always sort of get in this mentality that you get it over and done with after calving season, but then you've got joining season, you know, you've got to get bulls ready for joining, so you just need to sometimes take it, I think, and suffer the consequences when you come back a little bit.
Yeah.
But
What do you do when you take time off? Are you a holidayer or are you a pot around home person?
I do a bit of both. Sometimes I do just take annual leave and just, fix water troughs and fences and stuff like that, just because I don't feel like I can take a break unless those jobs get done. My boyfriend and I go to like Far East Gippsland, so like Malignant, and then even up to Green Cape on southern New South Wales coast a little bit as well, going fishing, and there's no reception up there, so
nice.
phone can't ring, so we go up there a little bit as well. So we might go up there, we were thinking.
Well, there was a guy called Nathan Scott, I think it was. He does a bit of public speaking and buys in for farms, and he said you just have to book in a holiday.
Yeah.
Otherwise you won't do it, so...
The problem is that I go to things like conferences, like I often will go to Queensland for conferences, and so in my head that's a holiday, and then people are like, that's not a holiday.
No, not unless you stay the week after as well.
Yeah,
so.
That's right.
Oh, we'll get stuck straight into this one. So you messaged me a couple of weeks ago and said, what are you finding around the area? I'm talking to producers, and the first thing that came to mind was sore feet. We're obviously getting close to lambing and calving. I've seen a few limping sheep at the farm here, and we had a cow at home with a sore foot. What's going on there?
I find, and most of my experience, like really treating hands-on cases of lameness is in the dairy industry. And in that experience, it follows rain events pretty closely. So sometimes that can just be simple, plain old foot rot because, the skin's getting wet. And so, it's attracting bugs and things like that, which gives it a nice environment to grow in. But sometimes, if there's cracks or, there's damage to the white line, we can get a softening of the hoof, which then allows, again, bacteria and things like that to invade those sensitive structures, and then we get lameness as a result of that as well. So, it's a little bit to do with the fact that they're pregnant. There's more strain put on the body navigating, carrying a fetus around, but also, I find it very closely sort of follows those high wet periods as well. So
So the actual hoof soften, just like if I sit in a bath for too long, I get all soft and wrinkly. The same concept.
Yeah, that's right. So sort of broadly, when I think about what could cause lameness, I sort of divide it into a handful of categories. And so the first thing we'll think about is like just an interdigital infection. So that's most commonly foot rot, and there's a few different causes of foot rot which we can get from different types of bacteria and different combinations of bacteria that may be at the surface when the skin gets damaged. And And then you've got things like cracks, which can sometimes be genetic, but sometimes can be as a result of trauma or nutritional cracks as well. And then broadly...
I've heard of zinc in a lack of zinc, or adding zinc to diet can help harden up the feed. Is that... Go back to the nutrition for a bit. Is there a specific thing that causes feet problem, or is it a bit of one of those ones that there's lots of ideas and opinions?
Yeah, I was about to say it's a bit of a controversial thing, zinc and also biotin, because zinc and biotin are usually quite rapidly available in most pasture-based diets. I know anecdotally some producers that have found that they add zinc and biotin to rations, particularly with dairy farmers, where they can just put it in the mill pretty really easily. But yeah, there are other people out there that would argue it's all just witchcraft, and because there should be plenty available in the feed. So your lush green feed should have plenty of biotin in it.
What about zinc? Because we're fairly deficient in zinc in our soils.
No, that's a bit of a controversial one as well, because we should have reasonably... Like zinc deficiency, like true zinc deficiency is pretty uncommon.
Yeah.
So, yeah, some people do supplement it, and again, anecdotally, they do find that it helps a little bit. But, in terms of whether the science is there to support it, I think we probably just don't have enough data to know for certain, so...
Yeah. No,
and when I say like nutritional cracks, another common thing that we see again with your dairy animals and also any animals that are on grain is that if there's a grain overload at some point, we can get those poverty lines in the feet, which is the horizontal cracks, and that's caused by periodic episodes of laminitis, which occur secondarily to the grain overload. And then what I have seen...
What's the grain doing to the...
So it releases histamine, and it's very analogous when we've got a grain overload in the diet. It can upset the insulin regulation. And when we've got huge amounts of insulin being released in the body for extended periods of time, that insulin can upset the blood supply to the feet. Very, very similar to people that have diabetes getting gangrene. And we don't know exactly how that happens, but it's thought that the insulin itself damages blood vessels, which supply blood supply, obviously. So what can happen with animals that are on chronic high-grain diets is we get these poverty lines in the feet from damage to the laminae, which are very sensitive structures. And then you get all these horizontal ridges in the feet. And if they're really, really bad, eventually once they, grow out to the toe, when they're walking and that toe is under strain, they can break back quite aggressively and cause pain at the tip of the toe because it causes the foot to break over prematurely. And especially if it's getting back beyond the white line and even getting close to the pedal bone itself, we can see a lot of damage with that from, months after the actual grain overload event.
All right, so I've got one for you. You know about this heifer that we had at our farm, because I did call you, but you're running solo, so you weren't able to come out. So I had to go with a mate, trimming it, sore foot. We ended up restraining in the crush and picking up its foot, and it was soft to touch. And so I've got a paring knife, I guess, for the sheep.
Yep.
We end up just trimming back. And so is that what you're saying, that layer just underneath, or is that something else? Yeah,
so with that photo you sent me, that was a vertical crack.
Yeah.
So which is different.
No, so that vertical crack was an old one. That was healed up.
Oh, okay.
I didn't actually tell you, sorry. So
right.
Basically there was a thin layer of hard hoof on the bottom of her foot.
Oh, okay.
I pretty much had to cut all that off because there was a separation under that with soft hoof underneath. So I might have trimmed off maybe half her claw, as in it was only about 3 or 4 mil deep sort of thing, but trimmed back from the toe back about halfway, I guess, and then it started to be reconnected to her foot. So is that the line you're talking about? Or?
Yeah, from what you're describing, if there's been sort of a warping of that white line, it is a sensitive structure that, there is pain receptors in it. So, if there's a warping of that white line, sounds like maybe that cow... without having seen it, maybe that cow's not growing its foot back correctly, and so a functional trim can sometimes just reset the right
Yeah,
balance.
I don't know how
of the
functional
foot.
it was, but she's actually not limp. I checked her this morning again. She was better the day after. But what? Just quickly tell us what you actually got us to inject for her. So I think there's an antibiotic and maybe a pain relief.
Yes, we gave her a pain relief as well. And the great thing about meloxicam in cattle is that it actually lasts for 3 days.
Yep.
So we can provide, a semi-long-term pain relief from just a single injection. So, and because we were a bit concerned that crack was letting bacteria in as well, we put her on a long-acting antibiotic as well, which was Tetramax. So, yeah.
Yeah, well, that track, like I said, that crack had actually healed up. But what was interesting is these cattle have come from drought areas, so I'm assuming they have been fed some form of grain for quite a while as well. So sort of starts to make a bit of sense, I guess. As to why. Now, the other thing I did, and I do it to the sheep, and maybe I'm wasting my time, but I actually spray terramycin on the wound.
Yeah.
Is that a stupid thing to do, or is it?
I do it too.
Oh, that's... well, if the vet's doing it, must be all right.
Yeah, so I particularly, again, like with the dairy cows, it's quite common practice is that, we'll remove whatever defect needs to be addressed, and if there's any, particularly if there's like a exposed corium, which is the soft tissue that sits underneath the white line or the sole, if there's any exposed soft tissue, I'll often spray it with antibiotics. Again, absence of data and things like that.
Yeah.
It's whether it's one of those things we do because it makes us feel better.
Sleep better at night.
Yeah, I feel particularly with the Alamycin spray, it does help to sort of almost seal it up because it dries very, very quickly. Part of my reasoning is that I reckon it helps to dry the wound up really quickly so that it seals a little bit so that there's no more.
A whole lot of other...
Yeah, it's more so that it doesn't get recontaminated once the cow walks down the laneway.
Now, I'll go on.
The other thing I was just going to say, which I think's really revolutionised Lameness treatment in cattle, is putting blocks on the functional healthy claw as well to actually elevate those affected claws off the ground, particularly when, we've got cracks and things like that, to actually allow it just a couple of weeks to start growing back correctly so it hasn't got that constant wear and force coming onto it, which is going to potentially impede healing. There's actually some really good YouTube personalities out
Hoof
there.
GP.
This is the Hoof GP. There's also Nate the Hoof guy in the US. That actually, when I was practicing at West Gippsland, that was 2 days of my week every week was putting cows on trailers and doing lame cattle, and some days I'd do 20 in a day, and eventually I sort of wanted to do more than just lame cows, so I do other things now. But for a part of my life, that was what I was doing for a living. So
yeah. Now, they sprinkle something off on the infected hoof or the trimmed hoof and then wrap it?
I have seen that, and that's not something I've seen here. And I guess the only thing I'd say is to check whether that's... I can't even remember what it was called. I think it was salicylic acid.
That sounds about familiar.
Yeah, and I don't know. Just got to be careful with those home remedies that you're not... because, when we use products, they need to be APVMA approved. So that's the Australian Pesticides and Veterinary Management Authority. So they actually approve what products can be administered to food producing animals, and I don't know, and every country's got slightly different approvals and regulations and what you can and can't use. So I'd very much try not to steer away from things that I know are registered, because I just don't, from a residue perspective, you just don't want to end up on the wrong side of the law. So
do you strap or wrap?
Depends on the severity. If it's just, if it's a plain old toe or heel abscess, no. But, if there's severe underrunning of the claw, and, we've got a lot of exposed corium, yes. And sometimes that will just be a swab, a moistened swab packed against the sole and, wrap it up in a bandage. Some people that I've learnt from argue that, particularly in really muddy environments, all that's going to happen is the cow's going to walk back down its muddy laneway into the paddock, and what's going to happen is that bandage is going to get wet and contaminated, and it's actually just going to sit up against the foot and cause more problems than it's worth. And I guess the thing to be aware of, particularly the Hoof GP practicing in indoor dairy barns versus what we do here, which is more pasture based, it may suit what they do because it's a completely different farming system compared to here as well. So, that was one. So I know some people that don't bandage for that reason. I think it's a case-by-case basis. So, but it's not something I do routinely.
Now that block, that just wears off eventually?
Yeah,
they knock it off after
usually 2 to 3 weeks. I can't recall many times in my career that I've had to take them off. They're a real bastard to take off if you do. Particularly those wooden ones, they tend to fall off. 2 to 3 weeks is the typical. Yep. The ones that used to be used, which were the cow slips, they could be really troublesome, and sometimes you did have to go out and remove those because they were the plastic ones that wrapped around the top of the claw as well. So it's almost like a shoe that you put the claw into.
Sort of thing.
A clog is probably a good way to describe it. And they can stay for ages. So if they're not there, if they haven't fallen off beyond 3 weeks, I'd say probably take it off.
Yeah, because they'll be putting stress on one side.
Exactly. You wouldn't be super comfortable. It's a necessity to treat the infected claw, but you don't want it on there forever. Eventually you'll get arthritis and body compensation. So
yep. Now when you're trimming the feet, did you use a grinder with a paddle thing or a knife or both?
When I was doing it sort of professionally as a hoof trimmer, I'd have several grinders in my toolkit. So I'd have one with a cutting disc, which is a pretty savage piece of gear. So
yeah, I've seen them actually.
Yeah, so the difference with those is that I had them on a tipper trailer where the cow is completely restrained. So I would probably not use a cutting disc in field conditions now where we're just doing them in the crush, because I don't think you can get good enough restraint, and they're a dangerous piece of gear. Like they grab a lot. So now I use sort of like a coarse sort of disc that's got, it's hard to explain, but it's almost like a gravel consistency on it.
Yeah,
so
like
it's
a diamond.
Yeah, similar to that in appearance. And I've got lots of different discs. I've got sanders as well, so that we can use them for different applications. I
got Makita gear in the shed. I should have taken that up, because I actually just had the knife and I was just about to start cutting, and my mate Craig said, I wouldn't be cutting that way. I'll be all right. I won't hit me knuckles. And 2 seconds later, I took the top of my knuckle off as well.
I've done that so many times too.
Yeah. That's all right. The other thing I was thinking of is that you said you might knock it out. Is that what your preference is?
It was mainly because of your specific cow's problem with having a vertical crack. Sometimes in a crush, it can be really hard. You almost feel like you need to crawl underneath the animal.
Yeah, we're upside down, I guess, when you're lifting the foot up, aren't it?
Yeah, that's right. So particularly for vertical cracks, it can be easier just to knock them out, to do it once and do it properly. I'll always try with them standing, but the inner claw vertical cracks are really hard to get good visualization of. The other thing that's really good for vertical cracks is using a Dremel, and we've actually got handheld Dremels to sort of, because as you find, the knife can, unless it's super, super sharp, it can be really hard to properly dig out those cracks.
The hoof has a bit of a hard section, and then it goes into soft, and
that
was what I was trying to control. Like, I didn't take too much of the soft stuff and get through the hard stuff. A long-term prognosis, once we see one of these cracks, a vertical crack versus the horizontal, is there something you see and go, it has to go when possible, and the other one you go, it's just a once-off type of a thing? Probably
the one thing I would say, where I'd say no, that can't stay, is breeding animals that have got vertical cracks, because not all vertical cracks are heritable, but some of them are. Right. And you do not want a bull that's got a heritable foot defect running around and serving animals. So for that reason, particularly bulls, sometimes with cows, I used to say, just get rid of them. But then, since sort of having an awareness of thinking about where people are at with their stocking rate, if they're trying to rebuild herds after droughts and things like that, I'm a lot less, flippant to say, just get rid of that cow, because, you need to take a lot more in. That's just the whole, I guess, learning curve of going from being just a vet to being a vet and a consultant is, taking into account the whole farm business and going, it's a vertical crack in a breeding female. It's not ideal. You probably wouldn't want to keep its heifers, things like that. But, I used to just go, just get rid of it, because I got sick of going out and digging out vertical cracks. But after a while, I sort of started to realise that, when people are trying to build herd dynamics and things like that, maybe that wasn't the best advice. But I just have to warn people, I guess, that with vertical cracks in particular, I can come out and fix them, but particularly if they're starting in the coronet band, which is where the hoof is always going to grow from, they're going to keep coming back. So you need to weigh up the benefit of having that cow as a unit on your property versus the constant headache of dealing with a vertical crack every time the foot's under strain. So
yeah, so always, I guess, keep a record, because if you're looking to get rid of something, there's some first ones to go. So. Yeah,
that's right, because I'm sure there's probably cows over the years that I might have seen it twice, 3 or 4 years apart, and we don't go and look at the number and look at the history often before we get called out to the cow. We just go out and sort of deal with the problem, and they can tend to be problem animals for their whole lives. So
now, we haven't talked a whole lot about the sheep. I see more problems in the sheep industry with feet. We're not going to talk about proper foot rot. We'll just talk about benign foot rot today, because we were going to discuss a little bit. You said that's a whole podcast in itself, which we will actually follow up on soon. Something that producers don't like talking about if they do have a foot rot and problem on farm, but it does happen, and there's some good things coming out, you're saying, in relation to that. So
yeah,
which is good. But we will talk about scald. So this time of year, we've had a fairly wettish winter. Sheep are walking around in fairly wet ground, and coming up to lambing, a heavier year, we're seeing a few limping animals. What's the easiest cause of action if we do see a few limping animals in the mob?
If it's a benign foot rot, compared to a virulent one, which you said we probably won't touch on today.
We'll just maybe even diagnose the two. It's quite different, aren't they?
That's right. It's more of a sort of sliding scale, and you sort of mild scald, which is in between the toes. If you pick your sheep up and tip it over, that what we call the interdigital area, which is that skin between the two claws, can be quite prone to infection in sheep. And in wet periods, we've always got that risk of benign foot rot, and every farm has the potential to get benign foot rot because the bug that causes it is called Fusobacterium necrophorum, and it also is a problem with cattle. So that's a bug that lives in the environment, and it survives
no matter what.
No matter what. It's like Clostridial diseases. It's just something that's there, and when the conditions are right, when things get wet, it starts to cause problems. So sometimes mild foot rot can be self-limiting, and they can get over it without any sort of treatment. Sometimes just a topical spray is enough to clean it out. And in severe cases, sometimes antibiotics are necessary depending on the severity. So.
Yeah, well, we put in a foot bath a couple of years ago to run them through that, and so we're talking on the phone this morning about the use of different things. So formalin? Yeah,
one thing we probably will say is we can't use formalin. It's regarded as a carcinogenic agent. So you've got the option, as we said this morning, you've got your zinc sulfate and your copper sulfate, which were very much what we were taught at uni, and sounds like still the mainstay of treatment. So,
I was saying that zinc sulfate is probably more commonly used because copper is blue, and if a sheep goes down in that and you got a wool on your fleece, then there's issues there. But the zinc sulfate is reasonably cheap and it does an effective job. The one thing I learned recently is that after you've run a few sheep through, because I think it's maybe a 20% solution or 15%, I'm not sure, I'll have to look up, but there is a percentage, but it actually absorbs into the hoof, I've been told. And so as you run your first 200 sheep through, you might have to put another bag in the foot bath because the dilution goes down.
Yeah, I think off memory, again, this is searching the back of my memory as well, but you can start to get issues with just other things building up in the foot bath as well, so topping it up or even just changing it can be useful from that perspective. So
yeah, let's throw another couple of bags in. It's all good. So we're going to move on to something else. We're from here at the Gippsland Research Farm. I'll set the scene because we had our 19 heifers on a trial paddock, and so we weighed them going in and then weigh them going off just to get some more data for that paddock. And when we're pulling them out to weigh them, there was one that was really lethargic hanging out the back. The rest of them just ran straight out of the paddock down the laneway, and there was this one droopy ears, head down, tail down, and couldn't care less that his mates are running off. I called you up straight away, and on the phone, I don't really remember the conversation, but I explained those symptoms. And what did you first think it was on the phone? or possibility?
I think we were concerned it might have been pneumonia.
That's right.
Because I'd been seeing a bit of it, just because it does tend to follow cold, wet, miserable periods because the immune system's just not functioning very well when it's cold, no different to people. Because I think you said it was salivating a little bit at the mouth, which can sometimes be a symptom, and also just the fact that it was so flat and lethargic. And I think we also talked about Tyleria.
So is that the one you asked me to take a photo of its vulva?
Yes,
of the colour,
that's right.
And you said if it's white, I think it was.
White or yellow, yeah.
Potentially that. So we got it in the yards, took the photo and sent it to you, and you said it's not...
It's not Tyleria, yeah.
Not Tyleria, so we'll come out and do some more swabs.
Yeah, and I guess the reason we were trying to rule out Tyleria over the phone is because if it's pretty sort of easy to diagnose often with the vulval colour. There's not many things that will cause that severe pale or yellow discoloration, and in this region it's so prevalent. Just because, sometimes we'll just do those as a phone consultation because, unfortunately, with Tyleria, we don't have a treatment. So, there's nothing really we can add by attending. But because we could sort of rule that out over the phone, it meant that, there's probably something we can treat or investigate. So,
yep. So then you thought it might have been one of two more things once you got out there, just by you doing your assessment. Well, what did you actually do different to, say, what you can't do over the phone when you get out on farm? What are you looking for?
We basically just started with a full physical exam. And the first thing that sort of stuck out was I think she had a temperature of 41 degrees or something, which instantly went, oh, geez, this is pretty serious. Because,
the normal range for
normal temperature is sort of 37 to 39 and a half. So anything over 39.5 is considered a fever for a cow. Probably the important thing, because I know some people do take temperatures at home, which I think is great, but a normal temperature in a cow does not preclude an infection. It's great if they do have a high temp because it does confirm what we're suspicious of, but the absence of a fever in cattle does not necessarily mean that an infection's not going on. So,
and so you had your scope out as well, listening to lungs and
and
that was trying to rule out the pneumonia.
Yeah, and so I thought the lung sounds sounded okay, but probably the biggest thing that we noticed just looking at her was that she had a lot of nasal discharge, and inside her nasal cavity the mucosal surface was very red and irritated and unhappy. And also she had very opaque corneas, so her eyes were very opaque. And I think I remember...
Almost looks like an early pink eye
it
sort
looked,
of thing.
Yeah, sort of like an early pink eye, but it also didn't look like an infection, if that makes sense. Like the conjunctiva, when we think about conjunctivitis, it was normal. So it was just the eyeball surface that was cloudy, with the absence of, the squinting, which indicates pain, which we'd see in pink eye also. And I think I remember you commenting that she seemed almost a bit blind when you were trying to run her into the crush, because she was sort of crashing into fences, or she was almost using the fence to guide herself around the yards.
Didn't
as well.
Notice into down the track, but once we got in a bit closer, I could see a bit of cloudiness, and definitely was only, I think I can't remember which eye it was now, but one was worse than the other sort of thing, and bashing her way around just by feel sort of thing. So yeah. So then you took some swabs because you thought it might have been one of two things after
I
all
did.
this.
So my main two, because of those combined eye changes and nasal cavity changes, it sort of narrowed it down to two things pretty quickly. The first one being IBR, so infectious bovine rhinotracheitis.
Which in one sense, that's one that transmits between cattle, isn't it?
Correct, yeah. So it's an endemic viral pathogen of pneumonia in cattle. A lot of farms have got it. A lot of producers don't know they have it until they go to screen for export, and they find that they've got exposure. So a lot of farms have got it, and most people don't even know that they've got it, but it's a common viral precursor to pneumonia. But the other thing that I had in the back of my mind, because the research farm has got sheep, is a disease called malignant catarrhal fever. So malignant catarrhal fever is caused by the sheep equivalent of IBR, so that's the ovine herpes virus. So both of these sort of differential diagnoses were caused by a herpes virus, one being cattle adapted and the other one being sheep adapted. So the difference between the two is that if a cow gets infectious rhinotracheotis and we get it early and we, manage the secondary pneumonia, they can get over that disease. But with malignant catarrhal fever, they get worse and worse and worse, and there is no treatment. Basically, either the animal dies or we have to put it to sleep. So we took some samples, and because I sort of thought we'll test for one at a time, rather than sort of spending unnecessary money on diagnostics. But we decided to test for malignant catarrhal fever first because, and this comes down to...
Because you excited to see a case of this, Chelsea, be honest.
It's one of those things where you read about it at uni or in textbooks, and this was the first time I'd actually seen it.
And you said not many people you know have even seen it, is that correct?
Yeah. It's not super common. Like, I've been doing this for 7 years, and this is the first confirmed case I've seen of it. So
it did happen to be the... What was
malignant catarrhal fever.
There you go. So the sheep one, and which is interesting because you asked us if the sheep and cattle have been running together. They share laneways, but no commingling in paddocks, and possibly a couple of fence lines of interactions, but that's about all. But you also sent me some information that night on it, and the incubation period has really weird time, so it's really hard to diagnose when and where and exactly what too. So
yeah, that's right. So the typical incubation period is 2 weeks, but there have been experimental incubation periods of up to 9 months. And interestingly, I always sort of thought there had to be cohabitation of sheep and cattle, but from what I read, it can be airborne, not over a great distance, but if they're across a laneway from each other, that's considered enough of a risk factor, particularly if the wind's going in the right direction. So yeah, that particular heifer had somehow picked up the ovine herpes virus from the sheep, and often the sheep don't show any clinical signs of it. So, and this is again like the IBR in cattle. A lot of people don't even realise that they've got it. And so in the sheep, it was probably an asymptomatic disease state that that particularly unlucky heifer picked up the herpes virus, and for whatever reason has become sick with it. So we don't really know, why that particular heifer got sick, because theoretically, if she was exposed, the rest of the mob probably would have come into contact with it in some way or another.
The cattle can't pass it to each other.
That's right. So once a cow actually gets malignant catarrhal fever, they're considered a dead-end host to the virus. So they can't shed it to... We actually did isolate that heifer because we didn't really know what it was, but she actually wasn't a risk to the other cows in that mob.
And the next 2 weeks afterwards, I was checking those heifers all the time, hoping there wasn't a sick one or crook one, but it hasn't been the case so far, which is good. And then when the results came back, maybe 2 days later, she had gone down significantly. She was actually blind in both eyes, and we put a bale of good silage out, and she hadn't even touched it, also because she couldn't see it, which was a shame. So unfortunately, I was crook as a dog the day that I had to go up and put her down, and I felt like loading myself up on the truck as well that day. It was a bad day for me, but it's unfortunate, but these things do happen, and it was good to have a positive ID, I guess, of it in the end. Just on that, if there is something like this that's just popped up, is it something that's worth reporting to someone? There's disease I'm assuming you have to report, obviously. But
yeah, so particularly like that sample that I took got sent to a government lab.
Right.
So because those government labs report automatically to government authorities, we don't need, like as vets, we don't need to follow up with making sure that the government's aware of, because they get CC'd in on the emails of the results and things like that anyways. So, and a lot of the labs that we do use are government labs, or they have automatic reporting.
Those results would come back to AgVic vets up in town. So if there's like 3 or 4 of these out cases, they could go, oh, hang on.
There's something going on here between different properties. Yeah, that's right. That's right. So, it is a very good system in that sense. There's constant monitoring of what tests up positive, so that if there's spikes in places, we can be sort of notified. But I think probably the one important takeaway also is that with that particular heifer, like both of those differential diagnoses were herpes viruses, and all herpes viruses across all animal species. Once an animal has herpes virus, they've got herpes virus forever. So even with the cattle adapted IBR, once an animal has had IBR, they have the potential to have it again throughout their life because it lives in the DNA and goes dormant.
So it will flare up at stressful times potentially.
Yeah, that's right. So it's much the same as like with people. We've got the cold sore, which is a herpes virus, and so people get cold sores on their lips when they're exposed to herpes virus, and then that viral DNA goes dormant in nerve bundles when we're feeling okay, but then when we get sick, the cold sore pops back up again because we're run down, because the body is, the immune system's not working particularly well. So that is a unique feature of herpes viruses in general. So
that's another one we've got to put in the book. I'm going to be left with no cattle.
It's one of those things where, like with people, once they've had their first bout of herpes virus and then the second, they sort of do develop antibodies to it, which means that they do over time, like the likelihood of them getting a recrudescence of it goes down over time, and their body just sort of learns to live with it a little bit, no different to people with their cold sores. Again, unless there's a severely stressful event.
Yeah.
So I guess it just comes back to the fact that I think a lot of people probably have got IBR and don't even know about it because, if your animals are well-fed, healthy, and there's not lots of stress in their environment, they may catch herpes virus and not even show many clinical signs, and then it just lives in their body for the rest of their lives. And if they're well taken care of, it's often not a major problem. So
another thing to think about, but it's good to bring up these topics and discuss them. We're going to shift gears a little bit because I found, going through my grandfather's old paperwork, found some old pamphlets that was actually produced by the Australian Wool Innovation. No, the Australian Wool Board, back in about the 1945s, and I actually read out some of them to you and had a good old chuckle because things have changed a lot in that time, and you actually found some old things as well. But I just want to read out a little thing on jetting sheep. So, repeating jetting with one mid-season crutching is efficient and economical in controlling fly strike. It can be quickly carried out by station labour when a fly wave occurs. Now, dot point A, jetting mixture, this is what I thought you would find funny, Chels, is, so the jetting mixture is a combination of calcium arsenate is the most effective mixture and will protect the sheep for 5 weeks. What's calcium arsenate?
That's arsenic.
So they used to dunk the sheep in arsenic, and I'm assuming it was very effective because it just about kills everything around. Why don't we use that stuff anymore?
Because it's pretty toxic is the short answer. Like a lot of things, I think, coming back to the formalin in the foot baths as well, a lot of people probably just didn't realise how awful these substances were at the time. Like asbestos once upon a time was a great insulation of houses until we realised how nasty it can be. So,
Yep, so there's calcium arsenate or sodium arsenate was the two jetting liquids that they recommend you use. The other one, which was interesting, was a control for worms. And what did you tell me was quite common back then?
There's a nicotine drench.
Drench. So they used to pump it full of, they would have felt pretty good probably going out of the race then, full of nicotine. But
nice and relaxed. But
so there were some weird and wonderful things. And I often wonder what we do now in 20, 30 years' time, whether they look back on our notes and go, what on earth were they doing back then? Because even in your time, you would have seen some practice changes, wouldn't you?
Yeah, absolutely. And one thing I remember was a colleague once heard of a producer flushing their horse's mare with kerosene as a uterine flush because this horse wouldn't get pregnant, and they thought it had an infection, which is just I remember thinking at the time that no one should ever flush a uterus with kerosene unless they have a uterus themselves. Because it just, I just thought, only a male would do that, honestly. Because if you had a uterus, you just wouldn't think it possible. But...
Yeah, well, I remember my grandfather, it's not a uterus, but he used to bathe his dogs in diesel when they had mange.
Yep.
And so he goes, I only do half a dog at a time, otherwise it's a bit much for him. So I don't know. I don't know whether it worked well or what the go was, but that's one of the things I remember when I was growing up. So.
Yeah.
Very good, Chelsea. You're not going to get away though with the last question, our signature question. What's something you've learnt recently that surprised you?
I wouldn't know if it is something I've learnt, I guess. But I've been doing this postgraduate course in Werribee once every couple of months, which is training livestock vets to essentially learn how to coach producers to make better economic decisions. So we're covering things like epidemiology, farm economics, nutrition. There's lots of different modules that we're working our way through. And it was actually just one thing that Richard Shepherd said. So Richard is a local here, but he's running this course in Werribee during our economics session, which was that economics is a social science. And because when you sort of think about economics, you think of it as just graphs and numbers and spreadsheets and things like that. But when you really boil it down, and I started reading a book on economics after this, and it's so true, like economics, when you think about it, it's really just people optimising their own happiness. And it is a social science, and we use a lot of graphs and numbers to capture it, but in its essence, it is still a social science. And I don't know why, but that comment really sort of changed the way I think about how I communicate with farmers as well, because we're not just talking about dollars and cents in a spreadsheet. It's optimising happiness, as we say. So, yeah. Yeah,
it was, I can't remember who it was. I think it was the Agrista guys came in and they were saying a similar thing, is that extracting the most amount of money is not what everyone's looking for. Some people want an easy calving.
Yep.
And so they'll calve at certain times. It's not going to produce the most money, but it suits their lifestyle. And so I think when you start looking at that really big picture, you'll start making decisions for your clients that suit them better, sort of thing, even though you could see a few more dollars per hectare here or there.
Yeah, that's right. Like we've got some clients that will spare no cost to almost eradicate any sort of mortality from their herds, which makes them feel happy. Whereas some producers will look at the cost of, changing that mortality by maybe 1 or 2% and say, the cost is not worth the potential economic benefits, and so they won't do that, which is another way of farming, essentially. And everyone's got different things that drive them, I guess. So
well, just a quick example on our operation is we used to run merinos, but my wife hated looking at weaner merinos. Every time I go in the paddock, miserable little things, and so to increase her happiness and my sanity, we got rid of merinos. So even though their wool was good and they did a job for us, but no more merinos on the Michaelis farm. So. All right, on that note, Chels, good to have you in again.
Thanks for having me, Al.
I'll see you next month.
Thanks.
A big thank you for tuning in today. And remember, if you have a question about today's episode or a topic you'd like us to cover, reach out to one of our many platforms and join the conversation. We're here because of your passion and commitment to agriculture. Together, we can build a stronger farming future. This episode was brought to you by Herd Solutions, your local farm animal vets, servicing Maffra to Mallacoota.